Good morning and welcome to Oncology Data Advisor. Today we're having this interview in honor of Nursing Assistants Day, which is held on June 17th. And I'm joined by our editorial board member, Maria Badillo, the research nurse manager at MD Anderson Cancer Center, and two of her colleagues, Kimberly Hartig-Balderas and Erika Toledo. And today they're here to share what they do in their roles at MD Anderson. We're really excited to spotlight and hear more about these roles today. So with that, I will turn it over to Maria to start off the conversation.
Good morning, everyone. Thank you all for joining us today as we celebrate Nursing Assistants Day. Each year on June 17th, we take this special opportunity to recognize and honor our dedicated colleagues who work closely with our nurses to provide compassionate care to our patients, whether in clinics, inpatient units, nursing homes, long-term care facilities, patients' homes, or in the field of clinical research. Our nursing assistants play a vital role in ensuring the well-being and comfort of those we serve. Today, we are especially, like Kara said, happy to have Erika and Kim with us. I'd like to invite them to introduce themselves. Perhaps they can share a bit of the area they work in and how many years they've been serving as nursing assistants. Erika, can you start our discussion today?
Yes, ma'am. Good morning. Like she said, my name is Erika. Nice to meet everyone. So I've been in MD Anderson almost 1 year. I work lymphoma myeloma center. I am a medical assistant here. I do work with 3 wonderful teams because I do have 3 doctors. But Dr. Jane is the doctor that is in research. There's nothing more than I can say about him. He's just a great doctor to work with. I see how he's with his patients. All my team, my nurse, my APP, I do the clinical side. So I'm in with, with the patients every day. And I see how research, their with their medication, everything helps them. And I am very, very proud to be part of this team here because I know we do a lot of, we help a lot of people. We really do. I have been a medical assistant for 15 years since 2009. So this is a big difference to what I used to do before because all that time before coming here to MD Anderson, I used to do OB-GYN. So very different, but I love it. I get to meet wonderful people here, not only patients, but the people that work here.
Thank you, Erika. How about you, Kim?
Good morning. My name is Kimberly Hartig-Balderas. I have been at MD Anderson since September 2002. Growing up with my mom working here until retirement. She was here 32, 33 years, all in lymphoma. When I was younger, I saw how excited she was about work, going to work, coming home, and just the energy she has. So it made me want to do volunteer work here. So I did, and I was 13, 14, and 15. I spent my summer days here, the gift shop and the outpatient clinics where I worked with doctors and nurses and administrators and PSCs. I grew real fond of how closely the nurses work with each of their patients. And that's what made me want to apply here when I was able to actually start working, which I did. And I landed a job in the lymphoma department at the front desk for a year. Then I was asked to join one of the clinic teams a year later, which I did. And then I wanted to learn more because I saw how the research nurses were constantly interacting with their patients. And I'm like, okay, I need to be a part of this. So I transferred over to research and I've been here ever since.
Thank you for sharing your background. So, Erika and Kim, can you tell us why did you choose to become a medical assistant or clinical studies coordinator?
Well, like I said, when I was very young, 18, I did take a year off from school because I did not really know what I wanted to do. So, but one of my friends told me, it's like, well, you like medicine, you like science. Why don't you become a medical assistant? She said it's a quick schooling, but I learned that once I got into the program, I really loved, I'm a very people person. So I knew this is something that I would want to do because I love interacting with patients, asking them about their date, and that does brighten them a little bit. So that's how I basically got into it. And I did graduate it 2004, but didn't start working until 2009. But I mean, since then, I've loved my job. It's a wonderful job that you get to interact with different types of people. Mhm. Yes, ma'am.
How about you, Kim?
So I'm currently a senior clinical studies coordinator. When I was working in clinic at the front desk and as a PSC, I wanted to learn more. I wanted to learn why the research nurses were so like closely involved with our protocol patients. So to do that, I transferred over to research, where it now is everything I've learned. I've got it from the position I'm in. Um, I work closely with the nurses to ensure that the patient schedules are ordered, procedures are done, testing is done. Um, I help the nurses with survival follow-ups on protocols, survival long-term follow-up schedules, so they can focus on the active patients that are here now, and it helps alleviate them from the extra burden of the follow-up stuff that I can do, that I'm capable of doing. But we capture, we assure that all the AEs are captured so that the patient, if there's anything that the nurses need to go back and do, she's got it in her mind. Oh, I need to go check this, let me go ask this patient this and that. So doing my position now, it allows me to help the nurses, but yet also allows them to focus on their current active patients. So I can help them behind the scenes with the follow-up patients.
Okay. So Kim, what do you find more rewarding about this job?
So being part of the cancer fighting world, working closely with pharmaceutical companies, trying to find the new best drug, going through FDA audits and process and all that stuff, there's always going to be new experiences that are popping up, new everything. Working closely with the team, we get to be a part of that excitement of when a drug does get passed. So it's great to know that you were a part of that whole role, however long the study was open for, 5 years, 10 years, 20 years. So being part of that, knowing that you, even if it's a small, a slight part, that you were, it was it was because of you this was able to be accomplished.
How about you, Erika?
Well, for me, it's the patient care. The patient care, I love interacting with my patients, knowing that I'm just always, bubbly, and I know it brings someone a smile to their face. I love just how, and I've seen it too, like she says, with the drugs and the research, how it helps a lot. Fighting cancer. It's a big help for our patients in all of this. And I see sometimes they come very sick, because I've seen them when they come very sick and then they get on medication. And that always gives me such a good feeling when I see them come back, like in a month, 2 months, 3 months, and see how better they've gotten it because of the treatment that we give them. And that's just something that I just couldn't really put in words. But I mean, we've seen patients come in here in stretchers, wheelchairs, and then they come back and they're walking now, they're healthier. I see how more, you know, talkative they are to me. That's just brings something to me that I didn't think I would ever um how can I say, I don't want to get emotional, but it's just such a good feeling to know that I'm part of this team, and I am part of getting them to that place.
Okay. So I think this is my last question, and thank you really for sharing your how you work with our patients. So, are you planning to pursue any further education or certifications in the future?
Yes, ma'am. I actually would want to do I want to do sonography. That's one of my goals here, and I know how good the program is here at MD Anderson. So that's what I'm striving to do next in, helping patients. Yes, ma'am.
Okay. How about you, Kim?
For me, no on further education as far as going back to school. I do continue to learn here on the job, which makes me feel like I'm in school until retirement days, years down the road. I continue to learn the new of research throughout the year, the new guidelines that we have at the institution, or new guidelines that the FDA has. So learning and training here helps me keep a healthy brain.
All right. Well, thank you so much, Erika and Kim, for taking the time to share with us today. We truly appreciate all that you do for our patients, for our colleagues, and for our team. And your dedication does not go unnoticed. Once again, happy Nursing Assistant Day.